Hi everyone, and welcome to my YouTube channel, My Oral Health and I'm your host, Raphael Peter Galleh. I want to thank those of you who subscribed to my channel and to those who watched the last episode, the oral microbiome. In today's episode, we'll be talking about oral sex and the health implication. I know some of you love oral sex, but do you care to know about the health implication of oral sex? So if you want to know more about health implication of oral sex, why can't you just join me in this episode? Hi, once again, you're welcome to another episode of My Oral Health and I'm your host, Raphael Peter Galleh, or simply called RP Galleh. I'm an oral microbiologist. In today's episode of My Oral Health I will be talking about something very interesting. Something that most of you are familiar with. So today's episode will be centered on oral sex. Yes, oral sex. But trust me, it has nothing to do with what you are thinking. Yeah, like I said, today's episode is about oral sex, but the health, in fact, the negative health implications of oral sex. So in case if you don't know what oral sex is, oral sex actually is the sexual activity involving the use of the tongue, the lips, the teeth, the throat, or the use of the entire surface of your mouth. Oral intercourse, therefore, can be performed in the vagina, also refers to as cunnilingus, or the penis, refers to as fellatio, or in the anus, refers to as anilingus. Yes, some people insert their tongue or their lips or their oral cavity in the anus of another person. So in oral sex, there's the giver and the receiver. And the practitioners of this form of sexual activity always claim to have enjoyed it. But then, have you or have they ever taken their time to think about the negative health implications of this act? I doubt if they do. And unlike other forms of sexual activity that involves the use of protection, oral sex practitioners in most cases do not use protection. Therefore, they stand a greater chance of contracting sexually transmitted infections or sexually transmitted diseases such as gonorrhea, hepatitis A, hepatitis B, hepatitis C. In fact, all the types of hepatitis you think of. Syphilis, genital warts, herpes simplex, pubic hair, oral cancer, throat cancer, cervix cancer, and a lot of different types of diseases. So, one of the interesting questions that so many of you may be asking or will be asking is, how can these diseases be transmitted therefore? So you see, in oral intercourse, there's always the giver and the receiver. So imagine if the receiving partner is having wounds in his or her genital parts, and you, the giver, you're sucking or performing oral intercourse with your mouth. If this individual is having this infection, you stand a greater risk of, should I say, taking this bacteria or these viruses or these infections into your system. Again, if the giver is having sores or bruises or cuts or wounds around his or her mouth and is performing sexual or oral intercourse to the other partner, there's bleed or bleeding, the next partner or the other partner stands a greater chance of contracting these diseases. Another form or another ways in which some of these diseases can be transmitted is, for example, when you just brush your teeth or you had some dental activities and you get involved in oral intercourse, you stand a very, very high chance or a greater risk of contracting these diseases. This is because when you brush, the brush creates some microscopic or tiny wounds or bruises in your mouth or in your oral cavity. Therefore, these microorganisms can easily get into your blood system and cause some of these infections. Again, imagine you having oral intercourse with a partner that has 2 to 5 different partners that also have 2 to 5 different other partners. You never can tell. You may say, okay, you're clean, your partner is clean as well, but you don't know, your partner may be having another partner that has another partner that has another partner. So, if you trust yourself, do you trust the next person? If you do the other person trust you? So, these are some of the forms or ways in which some of these diseases can be transmitted. So, like I said earlier about some of the diseases that can be contracted through oral sex. One of those diseases is oral cancer, or also referred to as oropharyngeal squamous cell carcinoma. This type of cancer is caused by a virus called human papillomavirus, and it has been shown that in men that are involved in oral sex, this virus can be found in their oral cavity, that's in their mouth. So for example, if you have a partner who is a carrier of this virus and he performs cunnilingus, that is oral sex in the vagina, and if the receiver or the receiving partner is having sores or bruises in her own vagina, this virus can get through to her blood system through some of these bruises, thereby causing another type of disease called cervical cancer. So you see, human papillomavirus causes oral cancer or mouth cancer, it causes throat cancer as well as cervical cancer. Another form of, or another diseases. So again, I talked about contracting gonorrhea through oral intercourse. So you see, oral gonorrhea is caused by a bacteria called Neisseria gonorrhoeae. Now, Neisseria gonorrhoeae that is found in the oral cavity of the giver can be transmitted to the receiver through what I've explained earlier. Now, if the receiver is having bruises or sores in his or her own genitals and oral sex is performed, some of these bacteria can find their way into the blood system or to the bloodstream of the receiver, thereby causing some of these diseases. Another disease, like I said earlier, is chlamydia. Chlamydia is actually a fungal disease caused by a fungi called Chlamydia trachomatis. Although most of these diseases are hardly noticeable, but then when you begin to notice some white patches or red patches, yellowish patches in your oral cavity, it's therefore a sign that you should contact your doctor or go to the lab for medical examination to be sure what is happening in your mouth is not one of these sexually transmitted diseases. Again, I said research has been shown that HIV can be contracted through oral sex. For example, if a partner who is HIV positive had oral sex, let's say if he's the giver or the receiver and there are bruises in your partner's genitals, this virus can find their way into the bloodstream of the receiver or the giver, as such infecting your own partner. Again, oral thrush also refers to as oral candidiasis. is another form of diseases that can be contracted through oral intercourse. This disease is caused by a fungi called Candida albicans. So you see, for ladies that don't really know the differences in some of these names, they call it infection. They just call it infection. I had a toilet infection. Now, the toilet infection is caused by this same microorganism, Candida albicans. This Candida albicans causes oral thrush or oral candidiasis in the mouth. So now, imagine giving oral sex to a lady who is having toilet infection. The male counterpart or the male partner now can contract some of these microorganisms from her private part into his mouth. Or if a girl or a lady is giving another lady oral sex, that's cunnilingus, and her partner is having this fungi, she can contract this fungi through oral sex. So, like I said in my last episode of my oral health tonight about oral microbiome, that is to say, in the mouth there are hundreds different types of microorganisms that are found in the oral cavity. Now, if these microorganisms are being transferred to the private part, let's say to the vagina, through oral sex, finding them in that environment, which is not supposed to be their environment, they become pathogenic, thereby causing some of these infections. And again, if a partner transfers microorganisms that are supposed to be found in the vagina environment to the mouth, they become what? Pathogenic. So when I was talking about the good and the bad, or the beneficial and the harmful microorganisms in the mouth, now you can understand how some of these microorganisms can actually become pathogenic when they are found in an environment that are not supposed to be found. Now, to round up, I am actually not trying to discourage you from performing oral sex. No, that's not what I'm trying to do, with due respect to what you believe in. But I'm an oral microbiologist, and I'm trying to call your attention to the harmful effect of oral sex. And in case if you know, fine. But if you don't know, at least now you've known that, okay, the oral sex, there are what? Negative health implications to that. And again, before I round up, I will still want to thank those of you who subscribe to my channel, and to those of you who are dropping their comments in the comment section. Thank you so much. If you have any questions or any contributions you want to contribute to the growth of my YouTube channel, I would really appreciate it. Drop your comment and I will answer them. My oral health tonight again was brought to you by Raphael Peter Galleh, and I sincerely want to thank those who are partnering with this noble cause. Thank you so much. God bless you.